Guys, let's talk about lung cancer screening. It's something that we need to talk about because lung cancer is the #1 cancer killer in the United States. About 127,000 Americans die each year of lung cancer. So we need to do better. And people often don't know that they qualify for an annual low-dose CT scan. We think, oh no, CT scans have a lot of radiation. But these CT scans are called low-dose CTs. And the people who qualify for this annual screening, meaning, yes, right along with your mammogram, you want to be getting this done yearly if you qualify. So, who qualifies? People who are 50 to 80 years old and have a 20 pack year history. You calculate your pack year history by how many years of you've smoked and how much you smoke per day. So if you smoke 1 pack a day times 20 years, that's a 20 pack year history. If you smoke a half a pack a day times 40 years, that's a 20 pack year history. Or if you smoke 2 packs a day, then it's 10 years. You also qualify if you're still smoking or if you've quit within the last 15 years. Now, talking about COPD and other things is a discussion for another day. This is strictly for lung cancer screening. Why don't people get their lung cancer screening? Well, some people don't like to talk about their smoking history, and sometimes doctors are leery to bring it up just because we know that's another conversation we're going to have to counsel somebody, and so maybe chalk it up to laziness or just lack of desire to address the elephant in the room. But we're really doing people a disservice because many lung cancers are not found until someone starts coughing up blood. And in those cases, it may be very progressed. And we actually have a much better treatment rate when lung cancer is found in earlier stages. It's not necessarily the death sentence it was 15 or 20 years ago. So if you have that history, it's important to get your annual screening. There are millions of people in the United States that are eligible for this type of screening, and much of the time insurance covers it completely or at a reduced cost. Only about 5 to 6% of people who are eligible actually get this done routinely, so bring it up to your doctor at your next annual checkup. You're going to talk about your colon cancer screening and your pap smear and your mammogram. Talk about the other stuff too. It's very important. Breath is important. Then is the question about non-smokers. What about people who live in a household with heavy smokers? There's not currently a recommendation from the U.S. Preventive Services Task Force or the USPSTF, who kind of sets our screening guidelines, but that's a discussion you want to have. If you have lived with a smoker for many years, if you have a job where you're working in a smoky environment, then I would recommend those people get screened as well. I don't do as good a job of it as I should, but we need to be talking to people about their exposure risks so that we can know if we can find something small and early, it's much more treatable than if something is far progressed. So be proactive, talk to your doctor, and get the screening.